and welcome to another video by rampalsurgery.com, and I'm Dr. Sanjiv Rampal, orthopedic consultant here. So today we'll be talking about the three most commonest causes of knee pain in the elderly. So as we know, in the Malaysian shores, we have an aging population, and the knee pain is only second to back pain when it comes to patients in that age group. So today I'm going to clear up some doubts about the different types of knee pain that you may have and the causes. So the three most common causes that we see locally in Malaysia is, the most commonest is knee osteoarthritis, second most commonest is rheumatoid arthritis, and relatively rare cause of knee pain in the elderly is gouty arthritis. So a little bit about these few conditions of the knee. So we have the first one, which is the most common, and it affects more than half of the people who have knee pain in the elderly, is knee osteoarthritis. So knee osteoarthritis is a part of the degenerative aspect of knee, and it's associated with knee injuries, normal aging, and also very rarely infections of the knee. So now, what is knee osteoarthritis? Knee osteoarthritis is the degeneration of the cartilage level, the cartilage layer of the knee, which is in blue here. This is an example of a model of a knee. This is your thigh bone, your tibia or your lower bone, and this is your knee joint. So in the young, you have a blue nice blistering layer in the chondral layer, and this is what happens when you have knee osteoarthritis, where you have a pinched joint which has extra articular formation of osteophytes or extra bone over here and over here, and also you have the layers of the chondral getting eroded and causing inflammation. So how do patients present? Patient presents with stiffness, pain, and inability to fully flex the knee, and also a grating sensation over the knee, especially when initiating movements. So what are the treatments that we usually do with these patients? Usually in our setup in Malaysia, we usually start with first line treatments that would include, first line would be non-steroidal anti-inflammatory drugs, that's oral painkillers, that's non-steroidal in origin. The second line would be supervised physiotherapy sessions, at least about 6 or 8 of them sessions, a neuromuscular training of the patient, offloading of the joint, probably use of a cane. If the symptoms do not resolve within 6 to 8 weeks, options of intra-articular or into the knee injection, a short procedure that can be done as outpatient or in the clinic. And if all of this doesn't help the patient, then a total knee replacement surgery consult would need to be sufficed, or you probably need to contact your medical doctor for a referral to orthopedic surgeon or your medical practitioner. So the second most common cause of knee pain in the elderly is rheumatoid arthritis. This is an autoimmune disease. That means the body fails to recognize parts of our joints and also our own body, and it acts against them. So how does it present usually, and how is it different from knee osteoarthritis? So when it's associated with multiple joint pain rather than single joint pain. It's associated also with small joint pain, usually around the wrists, around the elbows, and symmetrically both sides. And it's also associated with morning stiffness of the hands. So when it comes to the knee, how is it different? So it's usually both sides rather than one side. It can occur insidiously or it can occur acutely, and it's usually pain on both sides, swelling and limited range of motion. So how would we treat it? We would treat it symptomatically with swelling management, thermotherapy. Also, we would start some anti-inflammatory drugs, and an early referral to our rheumatologist would be a good idea. So overall, we have seen in Malaysia a decrease in the use of surgery when it comes to rheumatoid arthritis of the knee, because we started some new drugs called DMARDs, or drug-modifying anti-rheumatic drugs, which has great success in preventing surgeries in these patients. So on to the number 3 most common cause would be gouty arthritis of the knee. So gouty arthritis is inflammation of the knee that's caused by accumulation of uric crystals, and also associated with increased uric acid in the bloodstream. So usually commonly occurs in the knee by having pain, swelling, and limitation of range of motion of the knee. So treatment would include anti-gout medications that would include allopurinol and colchicine. Another method is to reduce the purine-rich diets that would have high content of alcoholic beverages, any form of it, fish, seafood, and also other forms of meat, especially liver. So avoid them. Also take your anti-gout medications, and also usually we prescribe anti-inflammatory drugs of the joint. So usually gouty arthritis of the knee does not occur acutely and cause knee pain that would require surgery. Usually it's self-resolving in 2 weeks time, and it usually has preponderance of becoming a chronic problem in 2 to 3 years. Anyway, thank you so much for joining us this time, and also do follow us on all our social media outlets. Thank you.